Class here with Shane Talks Politics. If you are coming on here right now, send a message to every one of your friends, send a message to everybody you know, and have them watch this show today. We are going to answer a lot of the questions about this debate on COVID-19, on the proper control methods that ought to be used, how we can protect each other, but at the same time, we're going to talk about the mask issue. And we got Tyson Gabriel from Premier Risk Management, who's going to come on the show today. He is going to talk about the study that was used across the nation to what's the word I'm looking for? To present this mask ideology. So that's probably the worst way of saying it. I cannot tell you how excited I am about this story this morning, but before I get into that, let's do a quick recap of yesterday. Guys, I cannot tell you how impressed I am of our little community over here in Twin Falls, Idaho. In less than 48 hours, we mobilized over 200 people to show up at that South Central Public Health meeting. It was awesome. You know what? I'm just going to go. He's hiding in the background here. Let's just go ahead and bring out Tyson Gabriel. He is my guest today. Hi, Tyson. How are you?
Hey, how are you, Shane?
So I'm sure you're pretty excited. You've been kind of following this
Yes.
story over here. So I'll bring you on so that you can partake in this as well. We had over 200 people show up. We had about 40 people that spoke. We had people calling and emailing. Just in 48 hours, we had over 2,500 emails that were sent to our representatives around the 8-county public health district. And when it was all said and done, they voted no to the mask mandate. And after today's show, I think if any of those people see this today, they will be thankful that they voted no to it, because we have some important information that's going to come out today. I am so excited about this show. I cannot tell you. I'm bursting at the seams, Tyson. This is going to be so much. It's good information. It's things that everybody needs to know. It's things that every single representative that is out there needs to see, needs to be a part of this. And man, I'm not going to talk too much. As a matter of fact, you did a great job. I just want to thank everybody. Make sure that you thank your representatives. That is something that is so important. After they stand for our liberty, we can't just yell, scream, holler, fuss, and cuss at everybody and then turn around and not thank those folks that did the right thing. So we need to make sure that we thank them all. I also want to point out the difference between conservatives when they show up to protest and liberals when they show up to quote-unquote protest. That's not a protest, that's a riot. But we always leave things better than they were before. The staff, get this, the staff at South Central Public Health came out and they kind of cornered me, and I thought, oh boy, what's going to happen here? And they said, would you please let everybody know how impressed we were at how you guys conducted yourself on such a touchy subject. We had all of those people in there, and even though it's the staff that supports mask wearing and all of that, and they had their masks on, they were just blown away by how respectful everybody was of them, how they treated each other, and it was just phenomenal. So that's great. This might be some more breaking news today. I'm looking at the comments, Tyson, coming up.
Yeah.
And I cannot confirm this, but it's coming in the messages that so Minidoka County, the commissioners over in Minidoka County, a little background, they instructed their representative on the public health board to vote no to this mandate. When it came time to vote, she says, I cannot do that in good conscience. I'm going to vote yes for it. Yeah, she went against all the commissioners. She went against everybody. Wow. And what I'm seeing is that she resigned.
Wow.
So, you know what? That takes care of a problem because she needed to be gone. She needed to go. So if that is true, that's probably the most respectful thing that she could have done. So
That is crazy.
that is crazy. So yeah, that's all sorts of fun stuff coming in here this morning.
Well, what I'd like to, my comments on this, I just really want to, my short visit up there a couple of weeks ago, I was just so impressed with the community, the people that I got to meet, but very impressed with the leadership in your community. My hat's off to all of them because they're dealing with a lot of pressure from all angles.
Yes.
And for them to be able to take a step back and be willing to listen to a non-mainstream perspective, I think takes a lot of guts and a lot of leadership in being poised in such a tense situation. Because in the end, we all have the same desire. We want people to be protected. That's my business.
Right.
My job is risk management. I am here. My job, my component in all this is to get people home the same way they left. So that is my pure desire. It's non-political. It's just there's a way of doing it, and that's my industry. My industry is that component of this. That's what we are seeking to achieve, and we have fundamental engineering and scientific methodology that we use that's not being really propagated and taught to the communities around the country right now. And hats off to the politicians, and hopefully this can start that conversation and building that that understanding of how you can actually mitigate this through a prioritized technology and not have so much discord around your community with what to do.
Yes, and that is so important. And I've had some people just pop in here and ask if I can turn you up a little bit. So we're going to give that a shot and see if that helped a little. Hopefully that's better, everybody out there. I'm going to turn me down just a little because we were working on turning my mic up the other day. That way you guys can crank it up and I don't blow you out of the water, and maybe you can hear Tyson a little bit better on your side. So we'll give that a shot and see. I think I moved some things around a little bit, and we're seeing some consequences of that on the screen. It's just always a challenge, man. It's always a challenge trying to
technology will do that.
trying to make all of this work and work. We spent about an hour this morning getting everything set up so that this would not do what it's doing to us right this second. That's just, there we go. I think we got
Awesome.
you set right again. Yeah, real time. You're seeing us move things around the screen, but so hopefully everything works fine when we kick over to the presentation. So Tyson, what I would like you to do right now is give everybody your resume.
Okay.
So
I've been in this industry little under 20 years, degreed in environmental management and safety engineering. I've spent time working in the for health and human services to the private sector. I've worked for Fortune 500 companies to small family-owned businesses. I use a lot of different disciplines for risk management purposes. So safety engineering, industrial hygiene are my two primary components, but we also use medical science, which is a critical role in helping us understand contaminants and how they enter the human body, how they propagate in communities, and these are important things for us to utilize to be able to protect our clients and the surrounding areas that we try to help out. So I have the opportunity to work for Premier Risk Management. I had been with a up and coming, probably going to be a Fortune 500 company here if it's not already. And what we do at Premier Risk is we use a lot of different disciplines to help our clients achieve the goal of mitigating the risk for their employees and helping people get home the same way they left. So we have guys that are highly trained and skilled in fire sciences, safety engineering, and we do a large wide range of training and help people really understand the proper methodologies of achieving the results that they're seeking at work.
Let me turn it on so everybody else can hear me as well. You have worked with hospitals, doctors, nurses, training them on proper PPE. I'm not going to ask you to name any of your clients. I know that you have some confidentiality agreements out there. But speak to that just a little bit. What type of training do you do in hospitals?
Well, we do a lot of PPE training, control measure training, respirator fit testing. We use a quantitative methodology. It's a piece of equipment that I have. It's called the port account, and that gives a fit test to a respirator to ensure that it's a subjective test. So it's an objective test, not subjective like the qualitative method. And what it does is it ensures that it takes a sample of ambient contaminants and compares it to what's going on in the respirator to ensure that there's a max fit for that person. And also it helps them understand what size they need, because there are different sizes to respirators. There's a small, medium, and large, so it's not a one size fits all. And we go through the do's and don'ts.
Real quick, since you're
Yes,
talking
sir.
about respirators, just a real quick, can you make, for those who don't understand, because I'm trying to help my viewers really truly get an idea of this different. What's the difference between a mask and a respirator?
So a respirator, so if you take, for example, an N95 is the popular mask that people are discussing these days. So a respirator, you'll notice the N. The N stands for non-oil resistant. Then there will be an R, which is oil resistant, and then there will be a P, which is oil proof. And so when we talk about the exposure prevention planning, that consists of what kind of work environment are you in, determining what type of respirator, an N, R, or P. Then you go into the type of contaminant that you have, which would be either a 95, which means your filter is 95% efficient. That's an N95, 99, or 100. So P100, for example, would be 99.9997%. So that's a respirator. It achieves a seal to your face. It protects your breathing apparatus or your breathing area, and it enables you to work in various areas where there likely is airborne contaminants. Now, a face mask that has a completely different function. That is to be utilized by sick people who are overtly shedding a virus or a sickness. Basically what that is used for is to stifle coughing and sneezing particulates from getting into others' breathing area. It also is used for, you'll see doctors and dental hygienists will use it, and that is to keep rooms sterile, but then also to if they're working on top of over a patient, that prevents them from having droplets go into the patient's bodily area, because a droplet just from conversation goes a few inches. For it to go several feet, you would have to talk loud or yell. So if a dental hygienist, for example, is working on your teeth with your mouth right open, they're right over you, that is a good purpose to use that. That's a situation where you definitely want to have a mask.
I would be thankful for them doing that for my benefit.
Absolutely. Absolutely.
So continuing, I kind of derailed you there, but you mentioned respirator, and I wanted to make sure that people weren't thinking, that thing on there, and
Yeah. Yep.
So.
Yeah, and that's a great thing. That's a great thing to differentiate, because that's not being done right now. People are convoluting these studies with masks and respirators, and people are under the impression that they basically do the same thing, and they don't. So that has been proven through decades of research and science. 2020 didn't all of a sudden give us some kind of mysterious new science that changed that. So
yeah, you did some work on H1N1 as well.
Yes, yeah, and we have a COVID response plan for our clients that we implemented back in March. During my time at Health and Human Services, I was there during the H1N1 pandemic in 2009. So I had extensive training and in that situation, and we were able to deploy a lot of these same things to the federal government. For example, Customs and Border Protection and the USDA, to name a couple of agencies that really got hit hard during the H1N1 pandemic. So when this hit, our founder and we were able to come up with this plan, and our director of operations, we really honed this, and thankfully we've been able to implement it and really be able to achieve preventing outbreaks in our clients' work environments, and we've been able to see a positive result from that through this year. And just basically what it does is because there's OSHA and CDC guidelines and expectations. So what we do is we put those policies and procedures in place for our clients, and then we'll go in and do a scientific analysis of the work environment. So that's consisted of surface samples. So we'll sample your surfaces to see if you got COVID, and basically what we look for it's a two approach. I'm valuing your and then also I'm sampling areas that are not being cleaned to see if it exists in the workplace. So it gives you that confirmation of what's happening in your work environment.
So guys, the reason that I am having him go so in depth is there's so much information out there coming from so many different sources. And how do you trust that information? We're going to talk about that a little bit today. Tyson's going to talk about that. But Tyson is a scientist. He's not just some tinfoil cap guy that we're bringing on here to prove a point. I have been consulting with Tyson for what? We met just about a week and a half ago.
Yep.
I guess. And we have had we've probably been on the phone for 12 hours.
Yep.
If not more than that in all of our different conversations. And I've just been picking his brain. And I got to tell you, I'm so impressed with his company. I'm so impressed with him. They have offered their services for free to our city council, to our schools, to our community, to help put a plan in place that will actually work in our surrounding communities in the health district, to help put that plan in place rather than just this one size fits all, everybody wear masks, which, as you're going to see today, a little questionable.
Yeah, and really what I want to specify on that, what we're willing to do is sit down with politicians for a community plan.
Correct.
And give them strength. But obviously at the same time, we want to, we have bills to pay. So yes. Businesses and so forth need that. That's gonna take a lot of resources.
Money. Yep.
So I want to make sure
not coming into each individual building,
exactly.
doing risk assessments and all that kind of stuff, but as a consultant to help to point us in the right direction about what things do work and what things do not work. And really the thing is if you have a community macro plan, that's going to give politicians directive and a competent understanding of what they should expect the business community to do. Because really, if the business community is stepping up and being able to implement these controls, the virus is going to do what the virus does. So you're still going to have cases, but you're going to reduce that, and and the main thing that you want to mitigate are outbreaks. So if you have like single type cases. But what will happen is an infected person may go to a workplace that has 50 people. They infect those people, then they infect their families, and that begins the outbreak. So what you want to do is have the work environment secured, and you have mitigating controls in there that prevents those types of circumstances from happening. And that's what we would love to have the opportunity to do for the Twin Falls area. I think we have successfully shown everybody that you know what the hell you're talking about. You have the credentials, okay? and he could go on and on. Trust me. There are a lot of things that you can do. But right now, all of you, Tyson has a presentation that I have asked him to put together for all of you to give you some education, give you some tools, give you the things that you need when you're visiting with your elected representatives as we're having these battles that are going on. I want to get rid of the bullshit, and I can say that on this show, so and get down to what is real, and just cut through the nonsense. So that's what I asked him to do today. So I'm going to turn this over to Tyson here in just a second. But if you're friends with any elected officials, if you're friends with any of those people, quickly tag them. And start watch parties. You can do watch parties, whatever you want to do. This is information that needs to go out into our communities right now. And so please get that information out there to everybody. And Tyson, I'm going to turn it over to you, and I'll ask questions as they come along.
Sounds good. Let's do it.
We'll have a Q&A when this is all over. So I know a lot of you are going to have tons and tons of questions. I do not want to interrupt him too much going through this. So if you would, please hold those questions, write them down on a piece of paper, stick a pin in them, because I don't want you to forget them. And when we get into the Q&A session at the end of this, then I'll ask you to go ahead and start popping those questions up, and we'll ask those as long as we have time. It's all you, man.
All right, let's go ahead and dive into this. So I'm with Premier Risk Management. This is our company. That's our phone number, our website, premierrm.com. So if you have any questions, you need consultation, you want to implement our COVID response plan to your business, feel free to do so. I would strongly recommend doing that. One of the things that we're already seeing is companies are being hit at insurance renewals for having a COVID response plan in place or a pandemic plan. And we've been able to deliver that to our clients. That's been able to mitigate increases in insurance. So if you don't have anything in place, you're not sure where to go with this, this is a good proactive measure to take. A, to deal with the virus, B, to deal with OSHA, and because OSHA is coming in pretty heavy next year with COVID response, and C, it's going to help you with your insurance renewals. So there would be an upfront cost, but it pays for itself in dividend out in the aftermath in case you are dealing with one of those three or all three of those types of events.
Wonderful.
All right, let's go ahead and get into the next slide here.
Yeah,
So
you'll have to cue me. So
yeah, you bet. Yeah, sorry. So whenever we're putting together an exposure prevention plan, there's really a four-prong approach that we look at. The first thing, we need to know what we're protecting people from. So the contaminant is the key. The nice thing about this virus is that it's a weak virus. It's a protein covered in a layer of fat. And so during the summer months, it was able, like outside here in Arizona, it wouldn't have been prevalent because it decays in temperatures above 77 degrees Fahrenheit. And with that biological component of the virus if you think about what happens with fat when it cools down, so it gets a little bit more durable, which is why we're going to see more people be infected with this. But essentially it doesn't, there is a potential for it to absorb into your eyes, but it's not real likely. Inhalation and ingestion are the two main factors that you need to consider whenever you're dealing with combating the contaminant. Also, you got to determine your protective measures. This is a long-standing scientific methodology using the hierarchy of controls, which is what we're going to get into later in this presentation. But this is a prioritization method of how you need to look at what controls you want to put in place to mitigate the risk. And they're tried and true and proven through decades. So there's nothing new in 2020 that has changed this. Working environments. So kind of going back into what we discussed earlier about the respirators with the N, R, and P, your work environment, if you have, you're on a construction site and you might have vapors, gases, things like that you're dealing with, or chemicals, you're going to need more like a P versus an N. So you need to always consider your work environments because it does play a factor in what protective measures you put in place. And then the big thing, the 95% of what we deal with is human behavior, because that's the primary reason why safety and health programs fail is human behavior. If they have to wear PPE, they may not utilize it right. The PPE may not work. People just make bad decisions. That's just human nature. So that's where training and clarification to why you're doing things and how to do them correctly, and the expectation is so important for people to know whenever you're implementing a exposure prevention plan. And you go hit the next slide there. So these are the key principles that I always consider. That this is what I've used throughout my career whenever I've implemented a safety and health program. And as I mentioned before, I've done it for smaller family-owned businesses to Fortune 500. So these principles are key in every setting that you can implement a safety and health program in. So I believe it would be very critical in a community you're putting together a safety and health program for dealing with this thing. These are the three principles that you need to achieve in your plan. So I always look at, is my proactive? And that's the key thing. You don't want to just be reactive. And that's where a lot of people get into trouble, is they wait for the things to happen. But if you're proactive, you're mitigating that risk from taking shape into your work environment or place of business. So then the next thing is clarity. You want people to understand what you're doing, why you're doing it, and their role in making sure that it's successful. And my experience has shown that when people understand what to do and why they're doing it and their role in it, they really do achieve buy-in through that, because then people understand you're not just pushing on them to do something, you're explaining why it's successful. And usually when people understand the principles of why they're doing it, they're willing and they're going to do it, and people will get behind that. And go to the next
I would
there.
imagine that part of that is making sure that people understand the science, and that you have something provable you can back it up with is probably critical.
It is, and that's always the thing, because you always get questions from people, hey, why are we doing this? And when I explain to them, they're like, oh, that makes sense. Okay, yeah, because in the end, you're doing it to protect them. So when they see, oh, this is why you're doing it, to protect me, gotcha, I'll get on board with that. So, for example, I had an unhealthy experience of somebody wearing a wedding ring on a factory floor. I had given that training not to wear jewelry on the shop floor, and unfortunately, a gentleman got his wedding ring stuck onto a pallet that he was carrying, and that it injured him. I'll just leave it at that. So, those are the things that when we discuss it, and you can explain it, and I can tell you this: like, after that experience, I never had a hard time getting people bought into not wearing jewelry on a factory floor. So,
I can imagine.
yeah. So this is the hierarchy of controls. This is what we utilize as our foundational piece for implementing a exposure prevention plan. And what's key to understand about the hierarchy of controls is that each control is not equal in ability. There is a prioritization. Elimination is obviously the most effective. And then you take it down to substitution, engineering controls, where we try to isolate the hazard. You'll see that with like HVAC systems and so forth. Administrative controls are your policies and procedures, and you're dependent upon human behavior. So the reason why these elimination, substitution, and engineering controls are so much more effective, you're reducing the human element in those. But then administrative, it gets less effective because there's the human element, and you're trying to change behaviors through that. So if people are bought into following through with those controls, it's going to be more effective. But then PPE is by far, it's our last line of defense. It's the least effective measure. And that usually is pretty much your indirect contact with a contaminant. And this is utilized to protect you directly. So you're dependent upon the person wearing it correctly. You're dependent upon the person wearing the right PPE, and you're dependent upon the PPE working, which all those have a high risk factor of not operating in synergy whenever you're dealing with, especially if you have an extreme contaminant. So that's why we'll use PPE more as a redundancy, not as a centerpiece, unless you're really desperate and your work environment doesn't, like, there's no other control that you can put in place.
And I know that people are chomping at the bit for this question to come up with, masks and effectiveness. We're going to get into that a little bit. I've seen his PowerPoint as we were setting all of this up. Stay tuned, guys. You're going to want to hear this.
It's going to be fun. All right, so elimination, I'm using some examples that we use for our exposure prevention plan with COVID-19 for a lot of our clients. So if you look at these, staying at home, doing daily health checks, you're preventing infected people from entering your work environment. So the isolation, quarantine processes, and really that's the key, is you want to try and eliminate that exposure as much as possible through these protocols. And we go to the next one, which will be substitution. So obviously there's no substitute for COVID-19. It is what it is. It's not something we can control. But just as an example, so if you have a cleaning material that's cancer causing, you can replace that with something like Simple Green is a cleaning agent that people use as a substitute for other more dangerous materials. So this is just one of the ways that we would look at it, reducing risk. But if we want to go to the next one, engineering controls. So these are our engineering controls. If you have these in place, you're not really dependent too much on human behavior. But the two critical ones I like to talk about is the HVAC system, HVAC. So usually whenever you're dealing with a pandemic or viruses or so forth, you're trying to achieve a higher filter efficiency with your system. So a MERV 16 to 20, in that range, it gets more efficient. But then also you want to evaluate your HVAC system. And it's not just whether or not it turns on. You want to be able to evaluate how many air changes you're achieving in that 1 hour time span. So we do that. We have equipment that comes in. We'll come in and evaluate that. as well as you want to mitigate CO2 buildup, which happens whenever you have poor air filtration in your work environment.
So
So
air changes, you're talking about in the environment, in the room, how many
correct,
times per hour all
right.
of that air makes its way through the system and changes out, correct?
Yes, and
Yeah.
and typically what you're trying to achieve is 6 to 12 air changes per hour, but a lot of those ranges are dependent upon what type of room it is. So like a general office space is different than a conference room, is different than an office. So and there are engineering standards that are in place for that, and that's what will go into depth when we come in and do our study to make sure that that specific workplace is achieving the right air changes per hour. And we'll give recommendations of going to an HVAC professional and have that updated. And in a lot of cases, that's really what it is just kind of increasing the flow and making some upgrades to the system. Some systems are older and a little bit more difficult to achieve those things. So, and that's where the UV system, this is a new tech. So I'll explain the difference. There's been UV technologies in place for a while, but we came into contact with a company out here in Arizona that this has been a 3-year researched UV system that decays contaminants in one cycle, whereas most UV systems may take 3 to 6 or whatnot to achieve complete decay of materials in a room or work environment. So this is a more advanced system. What's nice about it doesn't really cost much to implement it. And so when you talk about the exposure point that the CDC has determined is someone being within 15 minutes or being within 6 feet of somebody for 15 minutes. And the reason being is that for someone to just normally speak, it takes about 30 minutes for you to expel the same amount of droplets that you would in a cough. So you have that 15-minute time range. And if you have a UV system that's decaying material, I know this system does it every 6 to 8 minutes. So if you're doing it every 10 to 15 minutes, you're mitigating that risk of airborne pathogens being in a workspace.
I've been studying this particular system you're talking about, and if anybody has questions about it, they can get a hold of me, and I can put you in touch with them. But that 10 to 15 minutes, the reason that's a good range, if I understand right, is because you have to be within 6 feet of somebody, or you have to be exposed for about 15 minutes to get enough of a load for it for COVID-19, for coronavirus to set.
Correct.
And if it's exchanging the air every 10 minutes, then you can see you're not exposed to it. Is that
correct? That's correct.
Okay. I'm trying to dumb it down as much as I can.
Yeah. No, that's good. And that's the thing. That's what's great about it. So when you talk about bars, restaurants, places of that nature, this would be a good system because you're not really going to be able to control the human element as much when people are intoxicated. So you have a system like this that's going in and cleaning your air essentially for you every 6 to 8 minutes. You're really avoiding people having the opportunity of being exposed to COVID-19 in a manner that would actually cause infection.
Wow.
Yep. All right, so then our administrative controls, and you'll see this in policies, procedures. So like the social distancing, hand washing, covering coughs, not touching your face with dirty hands, disinfection procedures. These are completely dependent upon people doing it. So that's why they're less effective. But if people do them right, they are highly effective. So that's why these are considered a higher form of control than PPE. And if you want to go ahead and hit that, and this is our PPE for COVID-19. So respirators, face masks do play a role in the exposure prevention plan, but it's not the prescription that's currently being delivered doesn't fit its intended use. We'll get into that here in this next little bit, but eye protection with the ANSI Z87 rating are key to this, as well as face shields, gloves. And but even with those, they should only be worn in situations where you're coming into direct contact with people that could be infected. And again, hierarchy controls. I want people to keep this in mind as we go through this study is like prioritization. What's more effective, what's least effective. And as we go through the study, you'll be able to see what's happening here. It's going to be pretty mind-blowing.
Guys,
if you want to go ahead.
What we're about to get into is so important. This is what you want to. This is where we get into misinformation versus good information, and this is what you need everybody to see.
Yeah, and this is where
I know I'm kind of. I don't want to let the cat out of the bag, but this is
yeah.
This should be on every single media source throughout the United States, maybe the world. Let's do it.
All right.
By the way, if I get kicked off of Facebook for this, I'm just gonna say right now, you can still find me on Parler. You can still find me on MeWe, and you can find me on Rumble. I'm just gonna put that out there right now. Here we go.
Yep. So what's important to know about this study? This study is on the St. Luke's website. It's on the CDC website. It's a very frequently referenced study for the justification for the prescription that doctors are delivering right now for mask use. And it hasn't been properly peer reviewed because my industry does play a role in this. And I don't recall anybody in my industry ever, I haven't seen anybody break this down. So this will be one of the first, and hopefully this can take it. And really what we're not trying to do here is say, hey, we got you, we're smarter than you. This is really just what my intent here is to really help people get a meeting of the minds on this. So yeah, the medical industry plays a key role in this, but so does risk management. And right now, that piece of the pie is not being delivered. And this right here will show you the deficiencies when you don't have risk management involved. These are the mistakes that you're going to make. And the people doing the research clearly don't have that capability and understanding how they're evaluating this and the prioritization of the controls. And so let's get into it.
This is being used throughout the nation.
It is.
I don't want to mention any names, but a certain individual that is kind of leading the things throughout the nation has referenced this study, and so this is critical to understand what took place in this study that's being used to say we ought to be wearing masks out in the public everywhere.
Yep. All right. So for people, what I would ask for them to consider as we're going through this hierarchy of controls, remember that prioritization of those controls, and that this study is it was done as a reduction for healthcare workers in a medical setting, which are controlled temperatured environments. They have the latest and greatest technology. So as we go through the study, ask yourself, can this be applied in my home, my place of work, when if I'm in construction or something of that nature?
Out jogging through Boise.
Yeah, exactly. And then and understand this, they intended this study to be transferred into actual society. And so when you're done, I want you to ask yourself, is this really possible? Like, does it have any relevance to being applied into our work and living environments? All right, let's go. So Mass General, this is the biggest hospital system in Boston. And what they had done early on in March, they got hit with a lot of infections. And so they responded, I think, brilliantly in their approach on putting in various layers of controls to reduce infections and protect their workers. And so this is the part of the study where they mentioned the multi-pronged infection reduction strategy is what the terminology is. But throughout the study, you'll find that if you read the study yourself, you'll find that they don't really mention what those controls are. We had to investigate through going to their website, public forums, YouTube, media, things of that nature, where we got to actually see what those reduction strategies were. And go ahead and get to the next one there. So there are 3 phases. The pre-intervention is basically before the mask mandate came in. So they're calling that March 1 through 24. And then the transition period when they implemented the masks. And really that was from March 25th to April 30th, because there was a lagging period where they didn't have enough supply of masks to give it to all their workers.
And guys, we're going to dig, Tyson's going to dig deep here. There's a lot of facts, there's dates, there's information that if a question comes up, I'm going to try to interject and help explain that a little bit better, or have him explain that better rather. But Pay very, very close attention to the details. the dates are critical.
Yep.
When you're watching this. So take a look and see what they did throughout those dates.
And the key dates to understand is March 24th to April 5th. And pay attention to those dates and see how all this breaks down. We'll get to the next slide there. So infections went from 0 to 21% between March 1st and 24th. But then there was a decrease at March 25th at over 14%. So you could see before March 25th, there started to be a decrease in infections. And so we're going to get into how that was achieved. So what had happened at the end of February, there was a world conference, a medical conference there in Boston where several people were infected. 70 plus patients came from that conference to the hospital system. And I haven't been able to verify all of it, of who was involved in the conference, but I would say it's pretty safe to say that people who work for this healthcare or this hospital system were also in attendance in the conference, with it being such a global scale. So the route of infections were coming from the outside and the inside. So you had employees that were already infected, bringing it to work and infecting their coworkers, as well as you also had people coming from the outside that were potentially infecting healthcare workers as well. So March 13th, about a week after the infection started on March 6th, when people started coming into the hospital, they began taking action. They had 3,700 staff members work remotely, elimination control. They had elective medical procedures were postponed, also in elimination control. The self-service vending machines were disabled, also in elimination control. And the Connor Center 7 was converted to an SPU. And if you go to the next slide, an SPU is an advanced place in a hospital where the HVAC system has high efficiency air filters, usually MERV 20s. And they have rapid air changes per hour, and they'll use outside air to prevent recirculation. Patient rooms are negative pressure, which means they're isolating the air contaminants. So if you have a patient in a negative pressure room, whatever they're coughing and breathing isn't going out to the hall or into other neighboring rooms. It's staying there while it's being mitigated out. And then healthcare workers typically have advanced pathogens training. So those would be administrative controls, but they'll have level B protection. So when you see people in their suits, working in these hospital settings, they'll have the what's called a PAPR. It's a positive air purifying respirator. And with it being positive pressure, it's any contaminants that are in there, it's being pushed out. So it's a great form of protection. I love a PAPR. They're great because they're so durable, and also with the air pushing out, you don't overheat in those things. So you'll get longer work and safer work from healthcare workers and whatever employees are wearing that type of PPE.
Now, I want to remind everybody, as you're listening to all of these steps that they took, that this is the study being used, or a study, a predominant study, being used to say masks work. And masks, I'm not saying masks don't work. This is what's being said, that the public should be wearing masks because that's what's going to cut back on the spread throughout our community. And they put all of these measures in place. So keep that in mind as he's talking.
Exactly. And see with this, you see a combination of engineering, administrative, and PPE controls, advanced PPE, not just these are very very expensive forms of PPE. I'll just put it that way, and they're very, very effective. So March 14th, a new visitor policy was enabled to allow a sick patient to only come with one person that was well. That's an administrative control. And in mid-March, I don't know the date when they started the cleaning measures, but they did increase their cleaning procedures, disinfecting procedures throughout the entire system. I know for us, our clients started doing that as well. So I think it's reasonable to say that mid-March is about when everybody started picking up their cleaning, their disinfectant procedures throughout their workplaces. March 16th, separate entrances for healthcare workers and patients, engineering control. All business travel was canceled to reduce infection from people catching the virus in other areas. And that was really a big concern early on, is because there was, Asia had a really bad outbreak, and so people were just keeping things within their community so they didn't run the risk of bringing it back with them. And then March 18th, the COVID testing drive-throughs were introduced, and there's a picture on the bottom right corner, and you see how advanced that is. Again, the engineering control right there, administrative control, and PPE were implemented for those, which that, quite frankly, that is an awesome piece of equipment right there.
Dude, that is, our hospitals, you can drive up and they stick that swab up in your nose while you're out in your car, and they're wearing a suit. But looking at this, you'd swear that they had the most dangerous pathogen known to man.
Well, you know what's great about this is that reduces your need for PPE. So you have that engineering control there, that barrier between you and a potentially sick person. Like there was really no need for her to even have a respirator on at that point. So because what she has on there is an N95, so there was no need for that, and she could have conserved that. So there, in that situation, you're fine to just operate normally without having to have that PPE on. And then what they also did on March 18th, they converted more hospitals to SPUs. So again, engineering, administrative, and advanced PPE.
And what's an SPU?
That's what we just discussed, the special pathogens units.
Okay, just making sure we're.
Yep. And then March 19th, the valet service was suspended, so that's an elimination control. Protocols were put in place to prohibit most visitors. Also, elimination, you're reducing the amount of potential sick people in your work environment. And then 25th is when the mask mandate came into play. However, due to a lack of supply, they didn't have the ability to fully implement it. And Robert Kraft, the owner of the New England Patriots, had N95s flown in from China on the New England Patriots team jet, and that didn't arrive until April 1st. So the N95s weren't delivered and implemented fully until April 5th for this mask mandate.
These dates, guys. Pay careful attention to these dates.
Yeah, let's go ahead and hit the next slide. So the controls continued. So this is during the period when the mask mandate was put into policy, but it was being implemented. They still hadn't received enough masks to be put into place. However, they started a mandatory wellness protocol for all their workers to ensure, because there were sick staff members, and they were using this to mitigate that from people coming back to work or if people needed treatment. And then also on March 28th, they were selected to do a clinical trial for an antiviral medication, which would be a engineering control.
And now we're talking about Brigham, this is all part of the same network of hospitals, guys. So it's safe to say they had implemented these measures all across the network to protect their workers and protect that environment. Can you see how much effort was put forth to mitigate this outbreak and to protect the workers and make sure they didn't have outbreaks across the network? But what's missing until April what?
5th.
April 5th is what they're telling us to put on our face. Yet this is the study that they're pointing to say that it was the masks that lessen the that fix the problem.
Right.
Think about this, guys. Just think about it. As he's explaining this, I'm just sitting here in my head. I'm going, "Are you kidding me?" But continue. You've got to be professional. I don't. I look at this and I'm like, "What the hell? What the hell?"
Well, in my desire here is to not to kick anyone in the legs or anything. It's to illustrate these are the deficiencies in the communication, deficiencies, and the conclusion that was reached. Because you'll see similar things in all the studies, but this is like the big study that's being touted, and it didn't take much. I mean, we started investigating this a few weeks ago, and it didn't take us long to find this information, but there's more information that we're going to go through, and more things that we're going to investigate to get more details to what they did. So in April, they also enacted a new system. It's so when you had sick patients in the healthcare system, to enhance physical distancing, what they did is they had healthcare workers treat patients outside of the rooms through these bedside iPads. So I would assume that they would go in there for giving them food, or if they needed to enhance equipment use or things of that nature. But when they were coming in just to check on them, they weren't going into the room. So these patient rooms were negative pressured rooms, and healthcare workers weren't putting themselves in that environment, because they were using this system, which is an amazing system.
They did a phenomenal job of mitigating. I haven't seen this at St. Luke's. I haven't seen this at the hospitals. I mean,
this is a fantastic.
Dude, they went crazy.
And this is the thing for me. This is a fantastic study on what you should do. It's just the conclusions from the mass study is incorrect. But
so, are you following? I want to make sure that everybody is following this. This is the study that they point to that says when they wore masks, then the cases went down, and they fixed the problem. The point here, if you haven't picked up on this yet, is alongside the masks, which they're touting as the cure-all, they did all of this other stuff as well. They didn't isolate the masks to see if the masks were what were fixing the problems. They did all of this stuff and wore masks, but they didn't have the masks until much later. And then they said, oh yeah, they put the masks on, and look at the study over here. Look what happened. Look at what they did over here. Masks work. Everybody ought to wear them. And that was the conclusion that they drew from this study. But look at everything else that was happening at the same time.
And this is why it's so important to understand hierarchy of controls, and why I've labeled them. You'll see at the bottom, elimination administrative. These are high level controls that you put in place that science and engineering for decades has shown that these are far more effective at mitigating your contaminants. So this is where this training, this hierarchy of control understanding isn't. I just don't think it was something that the researchers really had strong understanding of in their subject matter.
Continuing on.
Yes, sir. So this is the system. This is what it looked like. This is from the article that I found of them implementing this. So as you can see, they're using the iPads, and that's how they're operating through the healthcare system there.
And so they're completely out of the room. They don't even have to go in the room to see what's going on with that patient.
Exactly. Yep. Everything's remote. And then that's that video if you wanted to show that or not.
Yeah, let's just go ahead. So
okay.
This was a video that that one of the hospitals was just kind of putting out.
The health and safety of our patients, their loved ones, and our staff remain our top priority as we move into a new normal, knowing that COVID-19 will be with us for the foreseeable future.
We've launched our Safe Care commitment at all Brigham locations by implementing numerous measures to provide the safest possible environment.
When you visit us for care, you'll notice some things may look and feel different. In fact, you'll notice some of these changes before you even walk through our doors.
We'll screen you for symptoms of the respiratory illness at the time you make an appointment and again prior to your visit. If you have symptoms, tell your healthcare provider's office as soon as possible. You may be scheduled for a virtual visit, or your appointment may be deferred to a later date.
As part of our new normal, our expanded virtual care services allow patients to receive our expert care at home and help limit the number of people on site at any one time. Your healthcare provider will determine whether a virtual visit is appropriate for you or whether you need to be cared for in person.
Check in before your visit by phone or through Patient Gateway, our online patient portal, to limit your time in our waiting rooms.
our valet team is ready to assist you parking your vehicle. They wear masks and practice proper hand hygiene. The team protects the interior of your car with seat and gear covers, and they also wipe down steering wheels and keys with sanitizer.
All patients, visitors, and staff are screened for symptoms of respiratory illness before entering our facilities. Staff with symptoms do not return to work until they have recovered.
If a patient has symptoms, their appointment may be changed to a virtual visit, or they may receive care in a designated area where we use personal protective equipment, or PPE, recommended by the CDC to prevent the spread of the COVID-19 virus. Visitors who have symptoms are not allowed in our facilities.
Everyone must wear a mask in our environment. We give all staff, patients, and visitors a mask to help prevent the spread of infection. As you make your way to your appointment, you'll see we've modified our waiting rooms, dining areas, elevators, and other common spaces to support physical distancing. Our floor stickers and signs encourage everyone to leave 6 feet of space between themselves and others.
To limit the number of people on site at any given time, we've staggered patient appointments, and many of our administrative staff are working remotely. Our wonderful environmental services team has enhanced its already rigorous cleaning processes. They've increased the frequency and intensity of cleaning all high-touch areas. We require regular hand cleaning and provide hand sanitizer so patients and staff can clean their hands easily and often.
We hope this review of the safety measures we've implemented across the Brigham has been helpful. We have confidence in our efforts and hope you do too.
Deferring, delaying, or canceling care may lead to health complications, and it's so important that you don't delay care.
We're here to address your concerns and care for you and your family.
We look forward to welcoming you back to the Brigham.
The reason this video is so important, the reason that this information is so important is look at all the measures they were taking in that hierarchy of controls. Look at how much they were doing as well as wearing the masks. But they're not pointing out all of the other stuff that they did. They said, here's a study to prove that everybody ought to put on a mask and that that's going to mitigate the problem. It's going to fix the problem.
See, and I'd even throw in there too that them asking patients that are coming into their place to wear a mask, I think that's reasonable because you're trying to keep the environment sterile, which is why the masks, the surgical masks are used for. And then also what type of people usually come to in a medical center or a hospital? They're usually sick people. You want sick people to wear a mask so that they're not overtly shedding their sickness. So in that circumstance, I would support mask use.
Yeah. Just look at how much, it's amazing how much stuff they went through.
Yep.
I'm having people kind of pointing out, I had one question that popped up on the screen.
Sure.
I want to read the question to you and just get a quick answer. I'm going to go ahead and read this one. I was going to hold them to the end, but the question was, is this the study that caused the CDC to change their mind and say, okay, we're wrong, you should wear masks?
This is one of them. Yes. This is a big one. The CDC director, I've been trying to find the video, but I know he's referenced this study before. Yes. This was why this was the first one I went after to review and just make sure that I wasn't missing anything. Because that for me, my job is to mitigate risks. So if I'm missing something, I need to figure it out, because if I'm delivering recommendations to my clients that don't protect them properly, I don't want that on my conscience. And I know our business isn't built around giving people snake oil. So for us, what we want to do is make sure, are we doing the right thing? So this is why reviewing this was so critical. And we've been reviewing several studies. So this isn't just the only one we're reviewing. But this was a big one. This is one that's been touted for several months now. And that's why for me, just going through it, being able to find these things is pretty eye-opening.
Now, remember, they flew the masks in. They didn't have enough. They didn't have what they needed.
Correct.
So they did not have these expensive masks that they were using in this environment until, what was the date?
April 5th.
April 5th. When was the reduction? When did they start seeing the reduction?
Let's go hit that next slide. I'll show you.
Oh, yeah, that's right. It's coming up.
Yeah.
Okay. I got out of
Yep. You're good.
This is crazy, man. This is insane.
Yep.
Oh.
So they're saying in the study that reduction started March 25th when they implemented it or put the policy in place, but they didn't fully implement it until April 5th. But as you go back to the numbers at the beginning of this presentation, there was decrease before the 24th, 25th, because they had a mass level of about 20%, 21%. And then when they started measuring that again, it was down to 14%. So these controls, I'll just go through these key points here. The mass spreader event likely led to the staff and being infected, as well as it brought in a significant wave into the hospital system. The exposure prevention controls began taking place a week after the infected were admitted. And so you'll see that reduction likely happened because the infection runs on average 10 to 14 days. So you have that cycling through, and then you have these controls being put in place, which was all helping everything trend in the right direction of lowering infections. But so far what I've been able to determine, but there's even more engineering controls that I was able to discover here while we were prepping. 6 elimination controls, 7 engineering controls, 8 administrative controls, 12 advanced PPE protocols were put in place before the masks were achieved, or the mask mandate was achieved on April 5th. And the infection trends were already going down before the mask mandate was even, the mandate was A, first put in place, and then B, before it was achieved. But another problem in this study is that the masks convoluted N95s and surgical masks. They are completely different pieces of PPE that have completely different functions and applications. So if you're saying that an N95 is achieving all the success, well, yeah, because it's designed to protect the wearer. But if you're saying, if you're going to then throw in the surgical mask in that, you just contaminated your research, because then the surgical mask doesn't have that application. And then the study does not recognize higher controls and doesn't reference other controls that were put in place.
So now these were, let's just make sure that we understand. These are all the things that they were doing.
Mm-hmm.
And then there was a study that was done on this hospital about whether or not face masks work. Am I understanding that correctly?
You're correct. Yep, okay. You're correct.
And that study, as I'm seeing Doran just pointed out, the study did not point out at all any of the rest of the stuff that they did.
Nope.
Just they implemented the masks on this date, or they implemented masks. They had a mask mandate on this date, but it didn't say that it took this long for them to actually show up because they had to fly them in. Is that correct?
Correct.
So it was like on the 25th of March, they said wear masks.
Yep.
And the mask didn't show up until April something or other. And they said they implemented a mask mandate on March 25th, and the cases went down.
Well, what they're saying is the implementation period was March 25th to April 5th. So that's the time period from when they put the mandate in place to when they were able to fulfill the mandate. So during that time period, they were getting supplies, and that's why Mr. Kraft was so adamant in getting those supplies for them, because he knew how dire their situation was. But what he brought in was N95s, not surgical masks. So maybe there was a little bit of surgical masks, but N95s were the ones that were touted in him delivering from China, which N95s protect the wearer. So those would get a higher, you would receive a higher form of protection with an N95.
How does this happen? I'm going to let you finish. We'll
let's go to the next slide
later.
Yeah.
I'm like, how does this happen? How do we miss the mark this far? Okay, continuing.
Yep, let's go. So these are my conclusions so far in the study. Again, I just want to have it understood that we're still researching this. There's still more investigative work to do, so we're not done yet. But this is where we're at so far.
Who did this study?
With this particular study. But it was contaminated with more advanced forms of controls, and the infection trends were already heading down. due to the infection cycle and advanced controls taking hold in the workplace, that I just referenced. The N95s and face masks were not individually studied, and they should have been due to their significant differences in purposes. And whether or not it's a N95 or surgical mask, they do play a role in the exposure prevention plan, but they're a complement. They're not the centerpiece. They're not the silver bullet that people think they are. And this study does not have application to to work or living environments outside the healthcare system. And I think that was pretty evident in all the evidence that we've been able to show so far.
So if you wanted to achieve the same results in your community, every business, every place of work, every school, every single, everything, your home, everything would have to have every single one of these controls in place in addition to the face masks to achieve the same results. Is that a fair conclusion?
It is, but I'll say this too, is that you can achieve some significant results through the understanding the hierarchy of controls and putting in most commercial HVAC systems they're nowhere near what a medical HVAC system is, and that's just because that work environment, a medical work environment, is going to be dealing with way more potential issues and contaminants. So, but a commercial HVAC system, you're not going to be able to put a MERV 20 in most industrial HVAC systems, but you can improve it. You can do your air changes, the UV system that we talked about. But and that's, to me, the HVAC is a big part, but if you're able to move your air, cycle it through and complement that with some good protocols and cleaning procedures, you're going to significantly mitigate that risk. And then understand what your exposure points are. Remember, within 6 feet for longer than 15 minutes, because that's going to take you the same amount of time to expel droplets at the same rate like one single cough would do. So, and just understanding where those things are, but then also the elimination protocols I think are the most effective, where you're making sure that sick people aren't coming into your work environment. So I remember at the rallies, somebody had asked, well, what do you when you say, hey, the masks don't work at how they're being prescribed, and somebody asks, well, what about at work? Well, that's what you do, is you ensure that people are not coming to work sick. You put in a policy that, hey, because the COVID-19 virus does take form as a cold. It's part of that same family of viruses as the common cold. So sometimes whenever you're starting to feel sick and you think it's just a head cold or it could be the COVID-19. So in those situations, you want to make sure that people know, stay home, don't come to work. And doing daily health checks is a redundancy to make sure people are being honest to that. So,
Tyson, I haven't asked you this question yet. Who conducted this study and published it?
We'll get into that later when we fill our report out. I don't really. Okay. But it was done by a medical doctor. But okay. We'll get more into it.
You can be general. You don't have to name an exact
name.
Yeah,
but I don't really want to.
I was just curious what the credentials were. I mean, this does not seem to me. Now, I'm just an armchair scientist, so I read and study and do everything I can, and I think I kind of have a grasp on what a good study entails. You have to have a good control. You have to have. Yep. I mean, this doesn't seem to me that it followed any of the protocols of a real good, well controlled scientific study at all.
It was clumsy. It was clumsy.
This is my conclusion. I'm not putting words in your mouth. I looked at this and I went, what the hell?
Yeah.
But I don't want to get you in any hot water. I'm just going, what in the world?
And this is for me, for what I do, what we do in my industry is like we're looking at, we uncover every stone to protect people. So we're looking at this as does wearing masks in a general population, is it beneficial? And that's why we're reviewing these studies to really, because that's one of the things people will say, well, do your research. So that's what we're doing. And they really missed the mark on this. And there's other studies that are even there. You'll see the same principles where they don't identify hierarchy of controls. The researcher doesn't understand the hierarchy of controls. And then they do they jerry rig and some of their PPE to achieve the results that they're seeking. So there's just a lot of things that are wrong with these studies, and so what we plan on doing is we are going to research this. We're going to have them peer reviewed, and then we're going to take legal action to have those removed from the CDC website and have them rescinded. So because this and I know there's healthcare workers and stuff that are going to be upset with this, but the reality is, like, your job is to treat people after they've been hurt or they've gotten sick. Our job is to prevent it. And when you have quackery like this that's hit the mainstream, it makes our job that much harder, because we're already dealing, 95% of what we're dealing with is human behavior. So when you have people that believe that, this stuff is true, it takes away so much of our ability to help coach them and teach them and prevent them from getting sick, prevent them from getting hurt. So we play a big role in this too. And this is not just about healthcare workers or because y'all are doing a great job, but we need to do a good job too.
See, and Tyson
we need more synergy between our industries to make sure that we're achieving this.
Tyson shared that with me. His heart is that one of the biggest things. In fact, I'm going to back up through your slides. I want to go. Let me get back to this slide right here. I'm going to bring this up on the screen for everybody to see. So, if you look at the key principles that make safety and health program effective, this part right here, the buy-in and the clarity. So two of the three legs of that is that you have to, if people come in with a preconceived idea in their mind, getting that buy-in and providing that clarity makes your job very, very difficult.
Yes.
And so if there's misinformation out there, or people have this ideology that, well, all I got to do is just throw on a mask and it fixes everything. It makes it very difficult for his industry to succeed in their goal of getting everybody to buy in and do what they're supposed to do and take all of the necessary measures to keep themselves safe. Tyson has used this phraseology a lot with me. He said his company's goal, is to bring people home in the same condition they were when they left.
Yep.
So it makes it very difficult. So this isn't some kind of a mission to go out there and discredit anybody. This is a mission to provide that level of safety that they believe they need to provide to achieve that goal. You have to get rid of misinformation. You have to get rid of that. Otherwise, it's very dangerous and just makes your job more difficult. So you're trying to be the cure, the real fix.
Yeah, perfectly said. And that's our intent. This isn't political to us. This isn't anything like that. This is simply what our industry is about. It's really about getting people home the same way they left. So all I want is to bridge that gap, help people especially with politicians in this situation. I don't blame politicians for what's going on. They don't know. They don't have the background in this. But I'm very disappointed in our public health officials, because they clearly haven't really sought the expertise in their groups on being able to achieve these things. And I know some of them had that training. They know these things. I don't understand why they're not doing it and why they're not trying to achieve this. So what my hope is that, look, we're trying to keep people from going to the hospital. We're trying to keep them from going to the doctor. We're trying to keep them from being hurt and being sick. So in order for that, I think everybody in your community around the country desires that. And there are protocols and plans that we can put in place to do that. That is our business. That is everything that we do. We're all professionally trained in it in our firm. So my hope is that people will see this kind of information and be like, okay, this makes sense now. We need to dig further into this, and how can we apply this in our homes, in our work environments? Because I think the work environments are key, because that's where people from different households get together the most, and that's where the opportunity for outbreaks really occurs. So that's why I think the onus really needs to be put on the business community to really step up and put an actionable plan in place that makes sense, that allows you to operate, that allows the economy to continue to run, because you need an economy to fight a pandemic. You can't just go hiding in your home and think that everything's going to get better, because you have to have that economy. You have to have resources to make sure that we're successful at this. But we need to do what we've typically done in pandemics. Find out who does the contaminant affect the most? Elderly. Protect them. Do what they can. If you have a pre-existing condition, you're a higher risk. Protect them and do what we can for them. But what we also need to do in our workplaces is mitigate that risk as much as possible, put these advanced controls in place as much as possible. And people are still going to be infected. That's not a surprise. That's nothing new. You can't stop a virus from doing what a virus does, but you can mitigate it and you can reduce that risk. Well, we can help you manage that. So that's really what our goal is to make sure that we're helping people funnel through this and be able to come out on the other end of this successfully.
Tyson, as a couple questions have come up. I'm going to ask you one, and then I'm going to ask a couple of these other questions.
Sure.
As a community, if you were coming into I know you've been kind of working on a plan and putting something together that a community could use. Could you share just kind of a 30,000 foot overview? What, as a community, would you recommend that the city of Twin Falls, or maybe these 8 counties, what would you recommend they do that would really work?
I think they put in a pandemic response plan as a community. So emergency action plans. This is something we help our clients with, and it specifies what you do in those types of situations and scenarios. I think it's been pretty clear that shutting businesses down didn't really do anything beneficial for not just the economy, but for our communities. So I think there has to be something way more robust where it explains, kind of the hierarchy of controls. What are the control options that you have? How do they work and how do you implement them? And also have more education to provide more clarity for the community as to how know the contaminant, know what controls you can put in place. Also understand the behaviors that need to be implemented to make sure that this can be in place, that be properly in place, and understand your work environments and living environments. What would work there, what wouldn't work there. And that's where a community plan can come into place. And then when you get into the micro of it for the different businesses, then that's where we can come in, and that's what we do. We'll evaluate what will work, what won't work, and help you devise. We have action ready policies ready to go in, put you in place. We can help you, especially if you're dealing with an OSHA issue. We deal with OSHA all the time. So, and that's really our plan is intended on reducing the exposure for your employees and yourselves, and then also reduce your exposure with the compliance fees, and then also help you with your insurance, because the insurance is going to want to know how are you mitigating your risk in your work environment.
On that insurance, you mentioned something to me that's about to happen next year with insurance companies regarding businesses. Is that something that you're able to share right now?
I'll just say generally what's happening, and it just depends on what state you're in and who your broker is. But what we're seeing across the board is that carriers are nervous about this. This shut down the economy. This ruined a lot of businesses. And so what carriers are going to want to know is, what are you doing about that within your business? How are you mitigating exposure so your business doesn't close down, or you have to shut down for a period of time because you have infections? So they're going to have that expectation. And if you don't have something to mitigate that risk, your rates will go up significantly. And we've seen it.
So in your plan, how much responsibility is put on the general public as they're visiting businesses and they're going out and around the community? What would be expected of them versus what the business should be doing to help stop the spread within their own business and people at home?
Well, businesses would communicate their policy. So if you interface with the public, you'll usually see signage, floor markings, things like that, of what the business expectations are of the public. And so that I wouldn't put it necessarily on the public in that sense, other than basic things like the large gatherings do play a role in infections increasing. So be wise about that. And that's where you can reference the community plan. Okay, what are measures that we can take in our, if we're going to go and, go over to someone's house and have a large gathering or go to choir practice, what are some measures that we can take as a community? But as a business, the only onus you put on the community is what you need them to do to protect your employees and to prevent the outbreak. So But as a business, if you have, you'll see the plastic shields for between cashiers and customers that come in. That's an engineering control. So you're mitigating that risk. Businesses should evaluate their HVAC systems to ensure that they're achieving the air changes per hour that they need. And really, and you'd have to really go into more details after you see the workplace and what they should and shouldn't do. But those are general things that I think businesses and also the community can start implementing. But really, it comes down to education and properly understanding what role each control plays, and then also how they should be prioritized. And so that way, and I'll share a real quick experience. I have a friend who has a workstation, plastic shield, like tons of controls. We put controls in there for her. And so she didn't wear a mask. She had a client come in wearing a mask and rebuked her for not having a mask. Well, in that scenario, when you have the HVAC working, you have several engineering controls and administrative controls, there's not really a need for having that mask in that scenario. So, and that's where the education point comes in, where, okay, these are higher forms of controls, and this is why we need to do these things, because they're going to optimize my protection.
If people are social distancing the way they're supposed to, washing their hands, employees and the public washing their hands, the proper way, really getting in there and doing what they're supposed to do. How important does the cloth face mask, where does that come into play?
It's a prioritized use for certain situations. So disinfecting and hygiene are far more effective measures to take than wearing a face mask, and especially when you're dealing with a virus component. So warm water, soap, because the foam on the soap breaks up contaminants off your skin and gets them off. So, and what do you use it with your hands? You use it to eat food. So you leave yourself open to ingestion contamination. So being able to have those in place, and what I always recommend is wash your hands at least 12 times a day and after certain activities. And we spell that out in our plan. So what I want to make sure is that you understand, like, specifically, these things are far more effective, but the mask, again, going into, unless you're really in an environment that needs to be sterile, or you're someone that's sick, say you're sick, you're at home and you need to go out and get medicine, wear a mask. That scenario makes sense. But if you're somebody that's well, and you're not showing symptoms, people have had the debate of, one time they said 50% symptomatic are spreading it, then they said 25%. They said they're not sure, really knows. But I know personally of 13 scenarios where somebody had tested positive and nobody in their household or work environment got sick. So the thing to always remember with asymptomatic people, you might have the virus in you, but if you don't have a method of delivering it, you're not an efficient spreader. So if you're not coughing, sneezing, those typical things that you would do, if you're not feverish, the likelihood of you spreading it is very minimal. I just, the lack of clarity on that is pretty significant. But I know from what I've witnessed and what I've experienced is that I know asymptomatic people who have not spread it. So the likelihood of that being a risk is very minimal. But I would really focus in on, if you're sick, you have a cold, you might be coughing, you might be sneezing, you should wear a mask. But if you're well, now, if you're going into a medical environment, things like that, wear a mask, because they're trying to keep that place sterile. That's fine. But if you're going to the grocery store, how many times are you standing within 6 feet of somebody for longer than 15 minutes? Like, you're not gonna hit someone in the shoulder and get COVID. Like, you're not gonna go on a jog and COVID's gonna come get you out of the bushes. Like, it's just the things that we're seeing. Like, I'm in Arizona, middle of the summer, 110 degrees, and people are jogging with a mask on. You're adding risk. There is a downside if you use any PPE incorrectly. So, and that's where clarity and communication and training really comes into place. So, right now, we've been barked at to just wear a mask, and that's not a solution. It's a ridiculous thing that's being propagated throughout the country. And it's time for everyone to take a step back and just say, hey, you look at all the states that have mask mandates. Look at their infection rates right now. They're the worst in the country. So our governor here in Arizona the other day went on he had a conference and a media conference, and he went on there and he started off, masks work. Okay. But then so the media turned to him and said, okay, make a mandate then. And he brought up the point, if you look around the country at all the states that have a mask mandate, it hasn't achieved anything.
Right.
They have high infections. So he debunked his own point. And that's the thing, is like, knowing that masks work in certain scenarios is important, because they do have function and application in certain scenarios. But the prescription of just wear a mask, it's nonsense. And that's where we just need to have a little bit more analytical discussion and look at things a little bit more in detail and be more measured in our approach, and not freaking the public out on if you don't have wear a mask, the economy is going to get shut down again. If you don't wear a mask, these things are ridiculous, and it needs to stop. And people just need to, and which is what I really appreciate about where you guys are at. Your leaders are doing that, and hopefully that this can continue to grow, and people can, calm down and just let's take a measured approach. Let's be specific. Let's be surgical, and let's get it done. Because we don't need to live in fear of this thing. We understand it a lot more. People are still living in the mindset of March, but we understand so much more about this, and we can mitigate this and deal with this and get past this. So, but hopefully we'll have that opportunity up in Twin here shortly.
So coming back here, a couple of the questions that came up. Schools, what would you do? I know you haven't walked into a school building. So guys, there's so much, if you haven't seen already, there's so much that goes into this. You got to know the HVAC system. You got to know the environment. But you and I talked about this, and I think it's really important for parents, because parents need to get involved. Kids in masks at schools.
Yeah. So in a school setting, one of the wonderful things that is about this virus is it doesn't affect kids. It's basically like a cold for kids. Pediatric professionals around the world have stated that kids are not carriers, they're not spreaders, they're not getting severely sick from this. And if you look in countries like Sweden and even in Europe, they're not shutting schools down. They're keeping things going. So if a child is not the source of the contagion, if they're not the source of a spread, if they're not being negatively affected by it in a manner that's could be catastrophic, why are they the centerpiece of your exposure prevention plan? It doesn't make sense. But the faculty is, because we know as you go over 50, it starts getting a little bit trickier for you. But then over 65 is when it really starts reaching that max potential of fatalities for people. So those are the people that you've got to target in your exposure prevention plan. So protect the teachers, protect the faculty, have these measures in place for the faculty. The kids, you know what exposure they have in this? 1 out of 4 kids has contemplated suicide, and a high number of kids have committed suicide. One of our professionals in our firm, he's a firefighter, and the other week he was telling me about 3 high school suicides that he went to in just 1 week. So wow. This is an exposure for kids, and this is what we need to protect the kids from. We don't need to be going into this. Everyone wear masks. It doesn't make any sense. There's no science behind it. There's no strategy behind it. It's just something that people are doing, but I don't understand the point of it. And they're not addressing the 1 in 4 that are contemplating suicide. And it's almost like nobody's really responding to the children that are killing themselves. I mean, that right there is a very dangerous precedent that we're setting, and we got to protect if you're worried about protecting kids, which I think we all are, that's what you need to protect them from.
Wow. How do the teachers then, if let's say the kids aren't the centerpiece, so if the kids aren't wearing the mask, they don't need to because they're not spreading it, but the staff, what are some things that, just in general, without looking at the building, what are some measures they could be taking?
So you go through the engineering, start with the hierarchy of controls, elimination, daily health checks, keep people that are sick from coming into school, including kids. If kids are sick, keep them at home. I think the other thing you do is you have a virtual learning option. So if parents aren't comfortable, faculty is not comfortable, you have that option available. So faculty that's high risk, put them in the online learning option to where they're the ones that are teaching it. And parents that want to enroll their children into the online option, you give them that. And I think that helps eliminate a lot of those exposures there. But you don't allow people
that takes care of two problems.
Exactly.
That takes care of the parents that are scared, and it takes care of the teachers that are at high risk. It just removes them. And the hierarchy of controls, it removes them from the environment.
Exactly.
And everybody else?
Yeah.
There's a question mark after that. And everybody else?
Yeah. So, well, and then what you do is you continue down the hierarchy of control. So you're giving that online option, you're eliminating sick people from coming into the school. Then you start going into your engineering controls, and you look at your HVAC system. You look at, you can put guards around teachers' desks. You make sure that if you have a high risk teacher who prefers to teach in session, keep them out of public areas where people are bottlenecked. So like before class or before school, after school, lunch periods, things of that nature, and also reduce their exposure in faculty rooms and things of that nature. So
I think you said also that take the youngest. We had this conversation. You take the youngest teachers, the youngest staff members, because the younger you are, the lower risk you are, as long as you don't have some kind of other underlying comorbidity that, something that could become a comorbidity. But right. You take them and you put them in the hallways as the hallway monitors and such, because they are at the lower risk.
Right.
And then the rest of them, that as they get older and older and older, then they can separate themselves more from the other faculty and staff.
Exactly.
Yeah.
Yep, I like that. That's exactly it. And that's
it was your idea, so I hope you like it. We had this conversation.
Very true, Shane. Very true. And then you just continue down to the hierarchy of controls. You hit into administrative controls with your policies, procedures, social distancing, washing hands, disinfections, or disinfecting your surfaces, things of that nature. And then I would enroll teachers into a respiratory protection program. So if they felt like they wanted more protection, that extra layer, give them that option. And me personally, I wouldn't waste my time with an N95. Those things are only good for 2 hours in a medical setting. So the best thing for you to get is a reusable respirator. You can get those for about $15-20. And then you can get reusable, or these they're heat protected cartridges that you can use. They're good for about 6 months. So these are the things, and that's a huge cost savings, because a box of N95s
come out and another one goes in.
Yeah, there you'll see them. They attach onto the side of your respirator. So I have 3 sets of 2. So that's a 1.5 years worth of cartridges for my respirator. So for a 1.5 years, I don't need to worry about additional expenses for my respiratory protection.
And that cost how much?
Altogether for all of it's about $50. So they're a little bit. It's gone up a little bit with the pandemic, but typically in most years they're about $30-35 for that combo.
$50 for a 1.5 years worth of protection per teacher.
Yes.
And they're spending money on cloth masks for 100% of the students.
Yep. And they're also, and N95s, a box of N95s are $20-30. So you'll go through that box in a week.
If you're going to wear a cloth mask, if you feel safe, if you feel better wearing it, what are some of the precautions they need to take, and what are some of the proper techniques for using that? How long should they wear it at a time before changing it, washing it, whatever? Explain some of that, please.
So I'll get into the 2 most common masks that people are using are the facial or the surgical mask, and then also there's the polycotton one. I use a polycotton myself if I have to go into a place that requires it. But what I do is I wash them every week, and I have one for each day, and I put it into a little Ziploc so I'm not cross-contaminating with maybe my keys, my wallet, cash carries viral material. Cash and shoes are the most common carriers of virus material. So I do that to prevent cross-contamination. I don't wear it unless I have to. So I don't wear it driving my car. I don't wear it walking outside. I don't wear it because all you're doing is you're exposing your mask to possible contamination. The more you wear it, the more you breathe in it, the more moisture builds up, the more chance you have of material being attracted to it. So you increase your opportunity of infection if you're misusing it. So wear it minimally.
From what?
it could be the flu. It could be there's other contagions out there. So but what it's becoming a petri dish. The more moisture it gets, so you'll have virus retention potential with that. So that's what you want to avoid. With the surgical masks, those are one-time uses. So like for example, last night my wife and I went out for our anniversary dinner, and I had to wear a mask to get into the restaurant. And I forgot my polycotton, but I have a bag of surgical masks in my truck. And so my wife and I, we wore the surgical masks. We took them off right when we got to the table, and then we were able to exit out. We sat outside. We exited outside, and we were able to throw our masks away after that. There's no sense of keeping them at that point.
How long is a safe period of time to wear any kind of a mask, whether it be a surgical mask or a cloth mask? I guess not any kind, because there's a lot of different.
Yeah.
How long should you wear one and then change it, clean it, whatever? I mean, what's your...
So with my polycotton strategy, being able to keep it in a sealed bag throughout the day, wear it minimally, I'll wear it throughout that day. With a one-time use surgical mask, I throw it away after each use. I don't hold on to it because I don't want to have the chance of getting myself sick. An N95, there's a randomized controlled trial from Brazil that showed that an N95 in a medical environment, which you got to remember is a controlled air environment, controlled temperature, things of that nature, only lasted about 2 hours. So an N95, say outside, you're going to get less than 2 hours out of that. A surgical mask, which is made out of even worse material, or it isn't as superior to an N95, you may get an hour. So, but you also got to pay attention to the moisture, because moisture and heat degrade that material. So as that is being utilized, you got to make sure that you're being cognizant to that. And what I see is like people will have the mask and put it in their pocket, and you're increasing your chances of some kind of infection by doing that.
Workplaces. There's workplaces that are requiring their employees to wear a cloth mask, and they're working for 6, 7, 8 hours at a time.
Yeah.
Is that safe? Should they be making changes?
No, I would never recommend that unless you're like even the doctor. There's a couple of doctors that I know that I've talked to specifically about this in different states, and it does something to you physiologically. Like it's not a when doctor, he's a surgeon, and he's like it's not good. Like when I get done with my surgeries, I don't feel right. So even in that situation where he's not moving, he's in a positive pressure room that is controlled, even that is negatively affecting him. So when you work in an environment where you might be up walking around significantly, again, moisture, sweating, things that moisture is starting to build up through either your breath or your sweat, those things will negatively affect you. So it's we're seeing an increase in gum diseases, gum infections. I know some people that have told me in the healthcare industry where they're seeing an increase in throat infections, lung infections, things of that nature. And it's likely attributed to the mask use. I even know of a person who got such a bad nasal infection from continuous use that he has now lost his sense of smell. So there's inherent risk with that. What's that?
Is that a permanent loss of smell?
I don't know.
Oh, wow.
We don't know.
How long has that been going on?
I know for sure about 2.5 months.
Holy cow.
Yep.
Okay.
I'm gonna see him. I'm gonna see him before Christmas, so I'll follow up with him, see how he's doing.
Okay. With those masks, that one of the questions came up, the mask that you recommend for the teachers that you say it lasts you about 1.5 years.
Yep.
Where can people get those? And he was just asking that question. Where can he get his hands on it?
There's safety suppliers, eBay. I mean, wherever you, they're okay. You know what? So there's it's a 6,000 series half face 3M, and also a 7,000 series half face that's 3M. One is rubber and one is silicone. But what we can do is we can put those up on your video so people know what they look like and where they can go get them.
I'm just gonna pull it.
And then also I can put the cartridge types that they should get.
6,000 series respirator. Is that
half face? Yep.
Half face reusable. So
yep.
Right. Hang on. There was one right there on Amazon. I'm going to pull this up and ask you if this is. Well, these are pretty intense units. If it's the right thing I'm looking at here, is that it?
Yep. Yep. Yeah, you just get one of those half faces right there. You can put, you'll see the prongs on the sides there. That's where you're going to put your cartridges, and those have long lasting life. Especially if you're talking about being in a school, you're not going to be dealing with, if you're a welder or somebody that works with metal, you might have to change your respirator out every year. You're going to get a lot of stuff in it. But for somebody that's in a controlled environment, like a teacher or something, they're not going to have to worry about that.
One other person just asked the question. Her husband is a welder, and they're having him put on these cloth or surgical masks, and it says right on the box that they're flammable.
Yes, should not be doing that. 100% should not be doing that. That's ridiculous. And that's a good point to make, because there's a domino effect with every decision you make. So you think you're trying to solve one problem, but you've created more. So they probably, by having that rule, they've created 2 more issues for her husband. So, and that's where risk management, where you got to look at those things. You can't just say we're going to get tunnel vision on this issue and forget all the other potential risks that are in your work environment. And that's why we go in specifically to every work environment, and it's a different plan that we put in, that we specify for their personnel.
Heidi commented, I wear a face shield if masks are required. I'm curious if that does any good, but at least I can breathe in it.
Yeah. You're meeting the spirit of the law. But for all intents and purposes, a face shield is used to prevent splatter from getting onto you. It's not and the face mask intent is for them to prevent you from spewing your aerosols. So that doesn't stop that.
Okay. I'm trying to get and then somebody asked, does Tyson's company work globally?
Yes, we do. We're all over the world.
Okay. How do people get a hold of you?
I
guess it's on that first slide. How about
Yep.
I just go right back to this first slide real quick, and I want to bring this back up. So right here, it's Premier Risk Management, www.premierrm.com,
Yep.
or you can call 1-800-980-RISK. And they work in this area, guys. So if I want to make sure I'm giving him the proper plug here, they will, if you are an employer, they don't just work on COVID. If you've got, if you need somebody to come in and if you put all the right precautions in place, you can significantly reduce your insurance costs.
Yep.
In many cases. So understand this is what they do for a living. And we want to make sure that, he's doing a lot of work here. He's doing a lot of leg work. The time that he spent with me, the time he flew here on his company's expense to come speak at our rally. They're just a phenomenal, we've talked, Tyson and I talked quite a bit about even the owner of the company, and he's just a very giving person. And these are the kind of human beings that we ought to be supporting, that are willing to do all of this. So Glenn just asked, can you talk with those masks on, those big heavy duty respirator?
Yeah, they're designed for long-term use. Yep. You'll be able to talk through them. Now, it's not going to be as clear as not having it on there, but you'll be able to breathe. You'll be able to operate. There is some restrictions. So whenever you're wearing a respirator, you want to make sure that you pass a medical evaluation. So if you have pulmonary issues or things of that nature, it's not going to be recommended for you to wear a respirator. But if you pass all those things and you're fine in that sense, you'll be able to operate. But again, the one respirator that is the best, but it's super expensive, is a PAPR. It's a positive pressure respirator. But that it's got air coming in. It's wonderful. I used to wear one of those when I worked for Fortune 500 in their company in their manufacturing facility. So, but for all intents and purposes, that one will be fine. You'll be able to make sure you're fit tested as well, so you get the right size. Don't assume like a large is going to work, because I've seen pretty petite women wearing large respirators. You're not achieving any protection with that. So you got to make sure that you're fit tested properly for its use. But you'll get more. You'll get optimal protection, and it'll be more comfortable for you to wear than even a face mask.
I don't want to be leading leading question here or a response. So please feel free, correct me if I'm at all wrong.
Okay.
But I think what we've learned today, it's safe to say that mandates, that any kind of a law or ordinance or anything of that nature, a one-size-fits-all requirement from the government is not only ineffective, but can be dangerous because it doesn't come with the proper training and use. It does. There's certain situations like these mandates that you have to wear a mask. Well, then you go out and you fire up a welder wearing a cloth mask. You're putting yourself at risk.
Yep, absolutely.
So not only is it ineffective, it could be potentially dangerous and hazardous, and they have to take better. It's irresponsible.
And that's why I'm speaking out, and that's the whole point of this, is that message needs to be out there, and people need to have that understanding, and politicians need to take a step back and understand that you might be worried about this one issue, but you're creating more problems if you do it wrong. And we're seeing evidence of that around the country. So various states that are doing it differently and doing it wrong, quite frankly, they're suffering, and they're gonna continue to have that. So I think you guys have a great place where leaders are taking a step back and looking at this responsibly, and I think that's the way it needs to be handled. And we've already seen, like, we're watching it firsthand, the just wear a mask mandate being put out there. Look at California. they're about to shut down again, and so believe me, I've been to California throughout this. We have a lot of clients out in California. You talk about mask obedience, it is significant there. They wear masks everywhere. So if you want a clear study on whether or not it works in an actual real world setting, you can see it right there that prescription is not working. And that's where the education of hierarchy of controls, prioritization of those controls, and how to be surgical in your work environments is so critical to mitigate the risk, to keep you from going to the hospital, and to keep the healthcare workers safe from their exposures as well in their workplace.
We're at about an hour and 45 minutes. I don't know if you're coming up against a wall here.
I'm fine.
I'm good. I want to open this up for about 15 minutes. Let's give this 15 more minutes. If anybody has a question, throw it in there and we'll answer that. Is there anything else while we're waiting for those questions to come across? We're on about a 30-second delay, by the way, Tyson, by the time they say it versus what we say.
Sure.
So to kind of fill that time, is there anything else that you would like to point out?
I off the top of my head, there's not really anything that I think we've really hit a lot of things, but I think this is where, if you just go back to the key pillars of a good safety and health plan, meaning those principles of clarity and buy-in, for politicians that might be watching this, you're going to get way more. When you get buy-in from your community, you're going to get way more success. And if you have the proper clarity for people to understand the expectation and to why they're doing it, you're going to have optimal success. And I think those are so important, and make sure that the plan is proactive, and that's, if you're just trying to shove something down someone's throat, I've seen it in workplaces at a micro level. It doesn't work, and people aren't going to follow what you have to say. Even if you might be right, if you don't address it in a manner that provides clarity for them and gives them the understanding as to how they're achieving their safety through doing these things, people just aren't going to do it. And as we broke down the research today, it's fallible. So, like, there's better ways of handling this, and quite frankly, breaking down the research showed that there is better ways of handling it, and the Mass General study showed how excellent and wonderful they took things, and they really hit it at a different level than what most places are doing. So, if anything, take that study and say, yes, it can be achieved. You can get reductions in infections into a high risk area, but these are all the things that they did to achieve that. And I think that's where people need to get in, and hopefully, and quite frankly, I think there needs to be clarity as far as, everyone's talking about infections, but what I want to know is, okay, you got infections, but what does that mean? How many are asymptomatic? How many are new to the case count, but are old cases? How many are in the hospital less than a week? How many are severe and going in for a longer period of time? And how many are being treated at home? with symptoms. Like, we need to have more context to that, because right now it's just kind of all over the map, and when it's propagated in the public, it's cases. But
cases are going to happen.
I go to our hospitals here. They're not overwhelmed. In fact, they furloughed a lot of people, and so they, during that time period where they were supposed to be enhancing their practices and their facilities, they were reducing the number of staff. And to me, like, I think there needs to be some more expectation from that. Is, did you furlough people? Are you bringing them back? Did you open up? Do you have space in your facility that might be used for storage? And are you opening that up for more beds? Or did you just saw the study? Do you have negative pressure rooms? Do you have PAPRs? Do you have these things put in place for your healthcare workers? So these are all things that I think that we should expect from our healthcare systems across the country as well.
We're getting rapid fire questions here, so
we're
gonna pump them out.
Okay.
What is the single biggest hurdle that you're currently facing in getting this information out to the general public?
It's the propaganda,
acceptance, availability. Those were all questions along with that.
It's really just right now we're just in beginning stages of doing this research, but I can tell you, just like what we're dealing with firsthand when we talk to clients, the propaganda is so embedded in their minds that they think that this is the silver bullet to this. And so it's being able to overcome that. That's our biggest problem that I'm seeing right now, which is why now we're just going to, like, we already have the science, like, just in past trainings and things that we know of face masks not working in this manner, but now we're going to have to go in and break down the studies, and that's what we're going to do. And then take this and have the CDC resend these and take them off their website.
Has OSHA issued fines yet anywhere associated with COVID-19?
Yes, there's been 27 incidences around the country with that, $1.6 million worth of fines. 25 of those 27 facilities were medical facilities.
And what kind of fines? What were they fining them for?
They're fining for not enough PPE, no PPE training, no fit testing, improper measures being taken to protect healthcare workers and patients.
Now, wait a minute. Okay, this is me speaking, but isn't it the doctors and healthcare facilities that the states and local governments are listening to for their advice and how to deal with this in the general public?
Yeah, they're not the experts on it. That's the problem. Risk managers, industrial hygienists, and safety engineers are. We have that expertise. They're experts in the medical science of this, and that's where we work as a team. We work with medical facilities and doctors all the time, and it's very synergistic. So, but there's a lot of hubris going on right now where that piece of the pie is it's not being accepted, and I don't understand why, but a lot of these medical professionals, they know that we exist. They're just not utilizing that expertise. And in fact, I've done training with medical staff, and we'll do training for them, and nurses, healthcare workers will come up to us and say, I didn't know all that. I've never been trained on that. So, but there's definitely a gap there that needs to be filled.
Can a child wear an N95?
No.
At what age can you start wearing one?
I went 12, over 12.
What about a cloth mask?
I'm resistant to that, period, with kids, just because it does restrict your breathing, and you do have that area there that you're breathing in. It does decrease your oxygen level. A human being needs 19.5 to 23.5% oxygen for optimal viability. So when you start reducing that number, you can start causing restrictions in their lungs, problems in their breathing. Also, it can become a long-term health issue if it's improperly managed.
Is there any studies that you could, I'm asking this question, is any studies that you could provide me with that I can throw onto my website that we can use with these schools that are forcing masks on kids under 12?
There's nothing because it's such a new phenomenon, there's no long-term studies on this. It's just but we know the baseline of the science, and but there will be a study next year.
Oh, very good.
Yeah, we're doing one.
Oh,
yeah.
You guys rock.
We're doing one. So cool. We're going to do a 6-month study of personnel that work in various environments, and it's going to be through various seasons. So we'll have that study. We're going to test. Obviously, we'll have a control sample of an unused mask and somebody that hasn't been wearing a mask. But then we're also going to do a study where we want to see the mask contamination, and also any contaminants that are on the face from all day use.
Who would, they're asking, would OSHA be the, who my welder would contact about his mask situation if he's threatened with his job?
Yes. Yeah. You have whistleblower protection under that. You have a right to, if you go under the Occupational Safety and Health Act under Section 5, that's what you're protected under. So the employer is expected to know what the risks are, to understand your hazards, and to mitigate them for you. And you as a worker are supposed to follow through with protocols that keep you safe. But if you are in an unsafe environment, you have the right to petition your employer to mitigate that risk for you. And the Department of Labor is that arm that will help you with that.
I'm sure it would be kind of a tough thing. I don't want to. I always hate to say, hey, let's go get sue happy, let's get lawsuit happy.
Sure.
But it would just seem to me, if I was an employer with 50, 100 people, a big restaurant or something, and I told my employees that they had to wear any kind of face mask whatsoever, I would be scared to death that if somebody ended up not being able to smell permanently because of wearing that mask, being forced to wear that in that environment, and that became the problem. What is that risk to the employer? I mean, is there a risk?
There's a risk. It's
minimal, but still.
Yeah, there's a risk. I mean, but the main thing in that scenario is somebody got hurt. So that lives with you. Somebody you know, probably somebody you care about. Most employers care about their employees, and as a family member. So somebody that you care about got hurt. Work comp just went up. Now you're paying. Now you have loss of work. So if somebody is out of work for a period of time, they're probably going to attribute. They'll probably get an attorney and attribute their loss of smell to your enforcement of wearing the mask for 8 hours a day. You're going to go through that. You're going to the expense is just, and that's why it's so important to have a proper plan in place to make sure that, okay, hey, I'm doing the right thing. I'm protecting my people, and also my people understand, okay, this is what I need to do to enhance our protection, and you'll gain synergy, trust, and you'll mitigate those risks.
How important is the disposal process of the one-use masks? I see them all over shopping carts, parking lots, yet this virus is so dangerous.
Yeah, it's critical. I mean, and everybody, and this is the thing, everybody has the correct instincts. Those masks get dirty pretty quick. So you want something that dirty on your nose and your mouth? I mean, that's.
Well, we're talking about, we see them thrown away all over, and this.
Oh, yeah.
Up.
Yeah. It's the new straws of our country.
Yeah.
But people aren't going to address it right now because they need them.
Let's see. Kind of getting through the rest of the questions here. Here's a good. If we hired Tyson's company to do an assessment at our company, how long would it take? Depends on the company.
Yeah, it depends on the size of the facility. Usually within a day. Most COVID assessments take about 2-3 hours, depending on the space.
Okay. That was the same person that asked about, do you work globally, by the way? So
cool.
I think that's somebody who's very interested in getting in touch with you. Let's see. It kind of, there's a lot of comments and conversation going on. So I'm trying to wade my way through the conversation to get down to the questions. And I love conversation. I'm glad they're doing
it.
I think that gets through people who are pregnant. Should they wear a mask?
That's a tough one. I think it just depends on how far they are in their pregnancy. I think those are the things you have to evaluate, because the further you go with it, the harder everything gets. But there is still that element if somebody is sick and pregnant, you still have the potential to spread it. So you want to make sure that you're protecting others around you, and but at the same time, you want to protect yourself. So there's that balance where you got to evaluate where you're at health-wise and where your breathing is at.
Okay. Hey, Tyson, thank you so much. We're getting kind of down to the wire. I do have one other thing that we need to do here really quick. There is a bowling tournament coming up this weekend to raise money for Make-A-Wish. And this kid, by the way, if you don't already know, this kid at like 9, 10, 11 years old, single-handedly goes out and raises more money when they're doing these things than everybody else combined. He's an amazing kid, and I told his dad that I would give him a second. I'm going to bring him on the telephone call and
Awesome.
let him just talk about that bowling tournament real quick. So
Cool.
I've never tried doing this while we're also using the microphone for Zoom. We're going to see what happens.
First time for everything.
Hello?
Hey, how you doing, Glenn?
Hey, Shane, how's it going?
Good. Talk about the bowling tournament.
About that bowling tournament real quick.
Yeah, definitely.
I've never tried doing this
Oh.
while.
So
also using
Tyson, would you mute your microphone real quick?
Oh, absolutely.
I'm trying.
There we go. Okay, go ahead.
Can you hear me?
Yep, I can hear you. I think everybody can hear you now. So we were just getting feedback coming back in when it was coming out over the speakers and then coming back in through the Zoom meeting we had with Tyson. So talk about the bowling tournament real fast.
Yeah, first I just wanted to thank Tyson. Great information. So tomorrow, I know there's a lot of stress going on with the community. Fun bowling tournament. It's $25 per person. Sign-ups start at 11. Bowling starts at 12. It's a 9-pin no tap, so you can be a horrible bowler and still bowl 300. All you got to bowl is 9s. There'll be cash prizes. They're doing a 50-50 raffle. Of the 50-50, 100% of those proceeds are going to Braden's team for Make-A-Wish. This is a bowling tournament, bowling alley here in Twin Falls, Idaho, Bowlodrome. And this is our first annual bowling tournament for Braden, and it's going to be a great success, and hope to see you out there tomorrow.
And this is where, again?
Bowlodrome on Eastland.
Bowlodrome out on Eastland by the old Cinema 12.
Yep, it's a two-person team. Mixed, could be male, female, female, whatever. $25 per person, and it's a 9-pin no-tap tournament, and it's going to be a lot of fun.
Appreciate you, brother. Make sure everybody goes out there and supports that. We don't have to be fearful of going out into public. Just take the proper precautions. Make sure you wash your hands. That seems to be like the number one thing that we could be doing right now. That since they have enacted these mask mandates and they talk mask, everybody thinks that's secure all, and they've stopped hand washing, which is a better thing that they could be doing. So make sure everybody's doing that. But appreciate you, Glenn. We're kind of going on 2 hours here, so I'm moving through here pretty quick. But please, everybody, get out there and support that, because these nonprofits are hurting right now because of everything else going on. We need to do the work they're doing doesn't stop because we have a virus. So it's important that we get out there and we support these nonprofits and do what we can. So we appreciate everybody. Tyson, you can turn your mic back on here for a second.
Okay, it's back on.
I thank you so much.
My pleasure. My pleasure.
Coming on here and doing this today. I will give you a call here in a few minutes when we get done. Thank you, everybody. Thanks for showing up and helping do what you do. Make sure that you share this video like crazy. This needs to get out there. This information needs to go out, and it is so important that we're doing the right thing and not just going about things haphazardly. And that is our goal here. It's not that we're COVID deniers. We don't deny that there's a virus.
No, it's very real. Yeah.
We just we question the quote unquote science behind the mandate.
My whole thing is the strategy. It's all wrong, and the messaging has been wrong. And I'd like for us, we've done it that way, and it hasn't worked. And being able to be more surgical and precise with prioritization of our controls, I think that's what we need to be seeking right now.
Thank you so much, Tyson. Thanks,
My pleasure.
I'll give you a call here in a few minutes.
Sounds good.
Have a great weekend, everyone. We will see you again on Monday.